Once pain-free, it's in order to improve soft tissue quality through the range of motion. Exercises being shown are shown from the light to the more difficult ranges, such that the entire range of motion is rehabilitated. Shoulder rotation trainer with the elbow into the side, using a shoulder rotation trainer such that the humerus doesn't approximate into the acromion. 30 repetitions, lightweight. Shoulder internal rotation at mid-range, weight set for 12 to 15 repetitions. This is an exercise progression for maximal shoulder abduction and external rotation. Resistance is set for 30 reps. Increasing the speed increases the difficulty of doing this exercise. Balance training for the right lower extremity with support in standing. 30 repetitions, low weight. Coordination training for the right lower extremity again, and supported in standing. 30 repetitions per set and low weight. Balance training for the right lower extremity in standing on an unstable surface. 30 repetitions, low weight. Shoulder press in sitting with back support. Weight set for 12 to 15 reps. Shoulder press with no back support. Weight set for 12 to 15 reps. Shoulder press in sitting, unsupported, with increased speed of movement. This makes it more difficult than the previous two exercise samples. Weight set for 12 to 15 repetitions. Treatment dosage of exercise is dependent on resistance, repetitions, and speed of movement. Early development of pulleys only allowed for 2 of these 3 variables. On a regular pulley like this, a 14-kilo pulley, you cannot vary the speed of movement. If you do, the weights will go ballistic and you get a jolt in the eccentric phase. This pulley, the speed pulley or low inertia pulley, allows you to dose an exercise also according to speed. By moving faster, the inertia of the weight stack makes the resistance a little higher, making the exercise a little bit more difficult to perform. The most important part, though, is that you do not lose the weight by increasing the speed of movement. Increasing speed increases the difficulty of performing the exercise. A speed pulley then can be used for training certain throwing exercises, applying a baseball to the pulley, and you can go through throwing motions with either single components around the shoulder or the whole throwing pattern through the body. Soft tissue flexibility is also utmost important in the order to perform desired tasks without causing soft tissue injuries. Resistance allowing for 30 to 50 repetitions per set is indicated in order to enhance the functional quality. Movement is performed slowly with a static hold at end range or restricted movement. Pulleys are used extensively in the improvement of flexibility and range of motion. Exercise shown is shoulder extension, with a static hold at full range before returning down towards zero. The purpose of exercise shown is to improve thoracic extension. We are using a mobilization bench. The lumbar spine is locked in flexion to enhance the extension movement in the thoracic spine. Patient goes through full range, flexion to extension, with a static hold in full extension. The weight is set for 30 repetitions per set. The purpose of the exercise is to increase left side bending in the thoracic spine. The seat is lowered on the right to have lumbar right side bending to again exaggerate the force of left side bending by the pulley in the thoracic spine. Patient go through full range of motion with a static hold at full left side bending. The weight is set for 30 repetitions. The present exercise show improvement of hip extension in the left lower extremity. Patient is side lying with the right hip flexed, extending the left hip back and holding a static hold at end range of extension. The weight is set for 30 repetitions. Progression is up to 3 sets.